Cloudcast Media.
Drew Schlosberg Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
I'm Drew Schlosberg of Cloudcast Media, and if you know Matt Schulte is on the air, it must be Medicare time, and that is exactly right. Matt is the principal of Schulte Insurance Agency, been doing just iconic work for San Diegans for almost 50 years. Full disclosure, Matt is my insurance guy, and he's got such great, invaluable insights on insurance in general, but especially during this very complicated Medicare time that we always want to have him back on. It's probably one of the more popular shows, especially this time of year. Matt, how you doing?
I'm good. First time anyone's ever called my work iconic. I love it.
Exactly. Well, it really is, despite the fact he's a Padre fan. But, and Matt and I get into, some of my listeners know that I grew up in L.A., so I'm a Dodger fan, and Matt and I, over many beers, chat about that. Very friendly, we can't call it a rivalry because the Dodgers' rivals are the Giants, and the Padres are always trying to find one over here. And I think Matt just cut me out of his insurance business on this. Joined by my wonderful co-host, Kristen Fogel. She is the executive director of San Diego Writers, Inc., celebrating their 20th anniversary in 2024. I know as a mom of a young kid, and you're very close-knit with your family, insurance is important, is it not?
You know, it's funny. I was thinking about this on the way over here. I love the movie. I'm not a sportser, but I love the movie The Blind Side, which is undergoing some controversy right now, but one of her first lines in it is, any good housewife knows that the first check you write is for the mortgage, the second is for the insurance. And I think about that a lot, you want to be protected.
Isn't it crazy though that I think most people spend after their mortgage the most money on insurance? It's probably their second largest bill on average for folks. I mean,
especially nowadays.
It's incredible. The cost of healthcare is it's insane. And, you're putting so much money out there. It's really important to know that you're enrolling under the right plan, because there's nothing more frustrating than spending all this money every month, depending on a service that you need, and then finding out that it's not covered as you had anticipated it to be.
Yeah, absolutely.
Well, and that's what makes, I think your agency, I call it iconic, and I mean this, as I've shared with other people as well. You folks sit down, you go over here, what do you need? If you don't need it, that's your call on it, whether you need it or not, but you'll go over it with them and make it very clear. Now, understand you're not getting X, or you are getting X, and for X, you're going to pay Y. Just talk about, you guys are very, very customer centric, and it seems so obvious. Well, why wouldn't he be? Because there are many that are not, correct?
Yeah, in this day and age, everything is going by way of artificial intelligence and chat bots and, calling overseas for customer service. And then sometimes there's a disconnect there because healthcare, whether it be in India or wherever the call center may be, might be very different than what's really happening here. We put customer service first. We're a family-run agency. Our agents are available to our clients. We have traditional hours of Monday through Friday, 8 to 5. But really, I think, what goes beyond the application, the transaction, there's so much more to it. And that's where our office tries to shine. That's kind of the background of who we are, because things change. I mean, you have a baby, you get married, you age into Medicare. These are all big changes that happen to folks over the course of their life. And, with it, there's medical costs and there's healthcare expenses and there's options for people. And, back to my earlier point, I think there's nothing more frustrating than thinking you have a plan that's going to provide services with this doctor only to find out that doctor doesn't accept your plan, or, that can I put money into a health savings account? Could I have a high deductible health plan and have some tax advantages? All of these conversations are important. And most importantly, it's just the understanding, the education process. And you can't get that from artificial intelligence. You can't get that through a chat box. Sometimes you cannot get that from a call center. So having just that continuity of customer service and an agency that's there to provide that support is what makes us unique. That's our motto. I think our agency opened in 1975. I think that probably was the general model of an insurance agency in 1975. But we keep those principles and those values today in 2023. And there's a lot of information on the internet, a lot of great information on the internet. But we're there to make sure that you understand what you have or what you're about to enroll under is truly meeting what you anticipate and what you need it for.
Yeah, we're chatting with Matt Schulte. He is principal of Schulte Insurance Agency. I'm Drew Schlosberg. You're listening to another edition of Drew Schlosberg Spotlight on the Community Show, the nation's longest-running community podcast, now in our 17th year, brought to you by Mission Fed Credit Union. We're broadcasting from the cool-looking Mission Fed studios here in Scripps Ranch. Mission Fed been doing great things for more than 60 years in our community, joined by my co-host, Kristen Fogel, Executive Director of San Diego Writers, Inc. This is Medicare annual election period, and this is the Rubik's Cube of it. Boy, if you want your head to spin, try to figure out Medicare, which is why I highly encourage people contact an insurance agency that you're very comfortable with, and then if you don't, I'm going to recommend Schulte Insurance Group. Does your head not? Yours doesn't, but talk about how complicated Medicare plans are.
Well, this year in particular for our community, Scripps is such a huge player of healthcare in San Diego County. They've made the decision to no longer accept Medicare Advantage plans effective January 1st. There's tremendous impact to a lot of folks that have used Scripps over the years that are enrolled under a Medicare Advantage plan. I do want to make the distinction that having original Medicare with a Medicare supplement plan, you will not be impacted by these changes at Scripps. However, if you have a Medicare Advantage plan, they tend to work more like HMO plans. Some names that you might be familiar with is like SCAN. They're a big one. Some of the United Healthcare plans that are out there. Blue Shield has a pretty big Medicare Advantage plan as well. But if you're using Scripps, if you're not sure if you're impacted or not, you should either reach out to Scripps and confirm that your coverage is there, or call an agency like us, and we'll be able to at least give you the peace of mind of saying you're fine. Or if you need to continue with Scripps, you're going to need to pivot and look elsewhere for your healthcare moving forward because of the decision that Scripps has made.
Yeah, and of course, I was one of those guys that called Matt and said, because what do I know? Am I covered by this? And you go, no, you're fine on this, because, that impacted, 30? How many? 30,000?
It's a lot. I don't know the exact number, but it's a major impact for our community. And I do think that a lot of people who are not educated or informed or in the know, so to speak, are going to be caught off guard come January 1st when they go to Scripps. I think there's a lot of communication that's going out there, but I still think for many vulnerable people, the message might fall through the cracks, and that's my concern.
Right, exactly.
So can Dum over here get some clear about some terms? So Medicare Advantage, is that acting as like a primary insurer? And when you talk about Medicare Supplement, that's like a secondary?
Yeah, correct. And that's a great question. So there's a couple of ways to go about healthcare when you turn 65 and when you're enrolled under Medicare. So most people, or everyone, would have original Medicare. There's Medicare Part A and Part B, and that's your primary health insurance unless you opt into a Medicare Advantage plan.
Okay.
And then if you do enroll under Medicare Part A and B, then oftentimes we'll enroll someone under a Medicare supplement plan, which would act as a secondary insurance to Medicare.
Okay.
Gives you the flexibility to go to any doctor that you want to see in the United States that accepts Medicare. So if you live in San Diego, but maybe there's a specialist in Houston, Texas, or New York, or Drew's favorite city, Los Angeles, then with the Medicare supplement plan, then you have access to do so.
Okay.
With a Medicare Advantage plan, most of these plans tend to, and there are some PPOs, but by and large, they tend to be more HMO type of plans where you have a primary care physician And then that primary care physician will provide a referral to a specialist within their same medical group.
Okay.
So, like let's say, for instance, that I need to see a cardiologist and I go to Scripps. I would see my primary care physician and they would say, okay, we have a cardiologist in our same medical group. I'm going to provide a referral for you.
Got it.
So it's more limited in your access. You can't just freely pick up the phone and make an appointment with a doctor that you want to see.
Okay.
And again, these things can be very, very complicated and things change quite a bit. Medicare costs are going up, are they not? Or it depends.
It depends. Medicare's cost, I'd have to look at Part B. It tends to scale a little bit, but it's not going up that much. They have the IRMA, which is an acronym for Income-Related Monthly Adjustment Amounts. So your Medicare Part A, if you've worked during your career, you don't pay anything for Medicare Part A.
Right.
You're automatically enrolled when you turn 65. Your IRMA, that income-related monthly adjustment amount, is Social Security's sliding scale based off of your income.
That's right.
And that will determine your Medicare Part B premium.
That's right. And that is, and I can speak from that one because they do take some money out of your Social Security payment to pay that B. And then there's others such as the drug plan, so to speak. If you opt for that, and everyone probably should opt for that, that's not too expensive, but expensive is relative. Talk about...
But on that point, everyone should enroll into a Medicare Part D plan. And the reason why is because you only have an opportunity to do so one time per year if you're currently on Medicare. If you say, I'm not going to go on it, and they have a plan out this year that's 40 cents a month. So yeah, it is inexpensive. So, when we look at having a eligible prescription drug plan, let's say you say, I don't want to spend 40 cents a month. I don't take any prescriptions. Okay, but then what happens in July and August when you go to the doctor and they say, we need to prescribe this medication for you? Well, at that point, you would not be eligible to enroll under a plan until the next year's annual election period. And not only that, Social Security, for every month that you're not enrolled under a Medicare prescription drug plan, will assess a penalty for you.
Did not know that.
And it never goes away. It's for life.
Wow.
I mean, even if you start doing it the next year?
Doesn't matter. It's for life. And it's calculated by a percentage of the cost for each month that you could have been enrolled, but you chose not to be. So,
wow.
So if you can enroll into a plan that's 40 cents a month.
Do it.
Yeah.
It makes no sense not to.
Yeah. And I bet people don't know that. We'll come back. We're going to chat more with Matt Schulte. He's the principal of Schulte Insurance Agency. I'm Drew Schlosberg. You're listening to another edition of Drew Schlosberg's Spotlight on the community show, the nation's longest-running community podcast, now in our 17th year, brought to you by Mission Fed Credit Union, joined by my co-host, Kristen Fogel. She's the executive director of San Diego Writers, Inc. And then maybe what we can talk about or think about this when we come back from break are some of the fallacies with Medicare and all that business. And most importantly, when is the period to sign up? Because you don't want to miss that period as well. Or maybe some of the biggest mistakes people do when they aren't paying attention to the type of insurance they need, when we come back right after this break.
When you do your banking with Mission Fed, you get great rates on auto and home loans. That's good for you, but something good also happens for a lot of other people. We're not for profit, so we put money back into the community to help lots of great nonprofits to keep San Diego strong. So you're not just getting something good, you're doing something good. Come to Mission Fed. It's banking that's good for all.
Brand amplification is the DNA of Cloudcast Media, and our code is the powerful blending of sound, voice, and storytelling to lift local brands and their communities. Whether it is our Brandcast, Schoolcast, or Causecast platforms, the unifying ethos is all about this community, the one you call home. If you dare to dream and want to explore the brand amplification of Cloudcast, a national leader in local podcasting and other Winfluence strategies, please visit us at cloudcast.us.
I'm Drew Schlosberg of Cloudcast Media. You're listening to another edition of Drew Schlosberg Spotlight on the Community Show, the nation's longest-running community podcast, now in our 17th year. We are brought to you by Mission Fed Credit Union, joined by Matt Schulte, principal of Schulte Insurance Agency, joined by my co-host, Kristen Fogel. She is the executive director of San Diego Writers Inc., going to be celebrating their 20th anniversary in 2024. Kristen, did you have a question for Matt?
Well, I think we should just get back to what you were talking about, which is, when is this election period so people don't miss it, and what do we need to know regarding that?
Yeah, definitely. So every year, Medicare has what's known as an annual election period. They use acronyms for everything, so it's AEP. But the annual election period runs October 15th to December 7th each year, for an effective date of January 1st. Mm-hmm. And during this time, this allows someone to change their prescription drug plans, or if they've selected one of those Medicare Advantage plans that we talked of earlier, they can move from one Medicare Advantage plan to another Medicare Advantage plan during this annual election period.
Okay.
And supplements too? You can change the supplement during that time or not?
Yeah, the supplement actually follows your birthday. So,
really?
Yeah, of course, they don't make anything easy. But,
right.
But yeah, so your Medicare plan, you can move to equal or lesser coverage with another carrier if there's maybe a premium advantage or, for whatever reason you may choose to do so. And that follows the month of your birthday. So that's the time to look at Medicare supplement plans if you're looking to make a change.
Right, so you said December 7th is the deadline, right?
That's
so
right.
You advise people not to wait till December 6th, correct?
That's right, yeah.
Exactly.
Do it now. I mean, this is the time to do it. There's a lot of information there. You probably are going to want to, if you do have questions, then you may need some time to ponder those questions or bounce those questions off of us. But yeah, now's the time to do so. Don't get caught up. The holidays come around quick. And before you know it, December 7th is in the rearview mirror.
Right, exactly. Now, Medicare kicks in when you're 65, correct?
It does, yeah. So your Medicare you become eligible for Medicare the first of the month in which you're turning 65. So let's just say, as an example, like my birthday is November 19th. When I turn 65, I will be eligible for Medicare November the 1st. Okay. So it's always the first of the month in which you'll turn 65, unless your birthday actually falls on the 1st. So if my birthday was on November 1st, then I'd be eligible October 1st.
Right, exactly. So you had mentioned about penalties, right? Like the drug plan, which I never knew about. So that's interesting. If you're sitting there just out on your in outer space, you're not paying attention, and you know what, I didn't sign up for Medicare. It's not that big of a deal. No bueno, correct?
No bueno. So really, I mean, I think you turn 65 if you have individual health insurance plan, then you're going to go Medicare. Where most of the questions come into play is, well, what happens if I'm still working? Mm-hmm. I'm 65. I'm still receiving benefits through my employer.
Right.
Should I go Medicare or should I stay under my employer's plan? And that's really where you need to understand your cost under your employer plan. Take a look at your payroll deductions, understand those benefits that you have. And then we can look at, well, what is your income? How much is Medicare Part B going to cost you? And then how much are these other plans that likely would be best suited for you going to cost you as well? So we can do an evaluation. Does it make more sense to, stay under that employer plan until you're retiring or no longer offered those benefits? Or does it make more sense to waive coverage through your employer plan and take Medicare? I was speaking to a lady today who turns 65 next year, and it's going to be a win-win for her. She should take Medicare. It's going to cost her less, and she's going to have stronger coverage. But I've also had clients in the past in which they have very strong coverage to their employer and a very strong employer contribution. So delaying that Medicare Part B enrollment, which is on that sliding scale, that income-related monthly adjustment amount, makes sense to delay that until you're no longer offered that employer coverage. And with that, I want to be clear, because people tend to think COBRA is employer coverage, right? Right. So Social Security acknowledges the employer health insurance plan while you're an active employer to be qualified medical coverage. So you can delay your enrollment under Medicare. But you may be in love with your benefits. You may think, I want to keep these under COBRA. COBRA is not considered qualified. So at the time that you're no longer an active employee, you should not opt into COBRA, because then you're going to start incurring penalties. At that time, you really should take Medicare.
You know, it's interesting because, and I'm sure you feel this way, Kristen, if you like the doctors that you have and your husband has, and of course your son has, you want to make sure whenever you get to that stage to make that decision, I don't want to lose them if you indeed you're that way. And that's got to be one of the biggest concerns of people. What, am I going to lose my primary doctor if I go to Medicare? What's the answer on that?
Depends on which plan you select.
That's right.
Yeah. So, if we go with original Medicare, with a Medicare supplement, chances are you're not going to lose coverage.
Right.
We can cross-check it, but chances are I've never seen it happen in 20 years.
Right.
If you go with the Medicare Advantage plan, you might. So, so it's important to know, which plan are you going to be enrolling under. If there's one thing that I can communicate here is don't get caught up in all of these television ads and all of these mailers that you're receiving, because there's a lot of general information that's communicated through those, but it's not specific to your particular needs.
Yeah, and that's why you need to call, an agency such as Schulte or the one you're comfortable with doing right now. And again, because your health, we all know, is so critical in this day and age. When you go, is that covered? It's not covered. Insurance companies are, I'm not going to cover this. All of a sudden, now you're paying like $800 for a bottle of pills for a month that you were paying $8 for, in that aspect of it. So it is really critical to chat and to check in, incessantly on that aspect of it. Are there any fallacies about Medicare that just come to mind, or not really?
Well, I kind of want to step back to what you just said. The other thing with the prescription drug plans,
Please.
There's many, many prescription drug plans in San Diego County to choose from. But again, for your prescriptions that you're taking, a lot of these drugs have preferred pharmacies and some that are not preferred pharmacies. And so you may take drug X that might cost $2 if you go to a CVS, but it might cost $20 if you go to the Rite Aid, right? So you just need to make sure that your broker or whoever is helping you make these decisions is also helping you identify which pharmacy you should use to receive the best value. As far as the fallacies, I think a lot of the fallacies are just sort of what people get caught off guard with all of the television ads. I know Joe Naismith or Namath. There you go. A different generation for me, but Joe Namath. I mean, he does a good job. I mean, the senior ladies are still loving Broadway Joe, right?
Exactly.
But again, he's providing just general content out there, throwing around $0 copays and $0 premiums, and it's not necessarily it can lead you down the wrong path.
Sure.
Yeah. Well, again, it's the same thing when people ask me, as you know, my dad was a medical doctor. When people ask Y and Z about health, I go, have you talked to your primary physician about it? No, it's probably a good idea. Yeah, it's a good idea. Talk to your health agency about it. And if you don't have one, we're going to recommend, groups like Schulte. And you've always been very magnanimous, about this. There are many great agencies that are out there in this aspect of it. But if you want good customer service, absolutely, that's so important in that area. How do they get a hold of you?
So a couple of ways. Our office, 760-436-5015. Again, 760-436-5015. We do have an office. We're up in Encinitas. We take appointments. So, if you feel more comfortable meeting in person, we're happy to set up the time for you. More and more people are feeling comfortable with Zoom, so we're doing a lot of Zoom meetings now. But if you just want to just call and do an introductory phone call and find out who we are and see if maybe we're a good fit to help you, then feel free to give us a call. Yeah, and for those folks who are on the cusp of Medicare, you got till December 7. I suggest wholeheartedly, thanks for a wake-up call over here. Call now. Give you a chance to go through all the different programs. Kristen, do you have any final questions for Mr. Matt?
I was just curious about some of the outreach that you do. This Encinitas 101 struck my fancy. So what's that about? Yeah, so Encinitas 101. So our office is right in downtown Encinitas off of Coast Highway there. Awesome. Yeah, it's a great little area. It's a strong community of small businesses, and so we're active there. A lot of those businesses there are our clients.
And so it's a tight-knit group. The other thing that we've done and we've been pretty successful with from a communication standpoint is some members of our team will annually go out to community centers, senior community centers, and do presentations similar to what we're talking about today. And so really speaking with the target audience and helping them understand their options as they approach this annual election period of October 15th to December 7th.
Very cool.
Well, Matt, always a pleasure having you come in, and don't think that you can't talk to Matt at other times of the year. They still do some great insurance, and we'll probably get you teed up again in the spring. Always some great advice to share year-round on insurance that's so critical. Wishing you and your agency nothing but a great holiday season, and your family, of course. And I really appreciate you now rooting for the Dodgers moving forward. That is not true, and this is the last time Matt's going to be on the program. Matt, thank you so much.
Thank you, Drew.
You bet. Matt Schulte, he is the principal of Schulte Insurance Agency. I'm Drew Schlosberg. You've been listening to another edition of Drew Schlosberg's Spotlight on the Community Show, the nation's longest-running community podcast, now our 17th year, brought to you by Mission Fed Credit Union, continuing to do wonderful things for San Diegans for more than 60 years. Thank you very much. Kristen Fogel, my very cool and dedicated and magnanimous and wonderful co-host.
I like all that.
Yeah, exactly. Kristen writes the text for me to say all these things to her. She is the executive director of San Diego Writers, Inc. They're going to be celebrating their 20th anniversary in 2024. We hope you enjoyed the show.
You've been listening to an episode of Drew Schlosberg's Spotlight on the Community Show, amplifying the voices of social impact organizations, entrepreneurs, local nonprofits, and other community champions who shape the culture, creativity, and connectivity of San Diego community. Brought to you by Mission Fed Credit Union, bringing good things to San Diego for over 60 years. Learn more about what is good for you and good for all by visiting www.missionfed.com.
Cloudcast Media.